Hello everyone, welcome to my channel. In this video, I'm going to talk about hemorrhoids. Are you suffering with hemorrhoids or piles or any kind of diseases which is really been troubling you guys? Then this video is for you. First remedy which I'll be talking about is arsenic herb. Hemorrhoids burn like fire. Burning is revealed by sitting in hot water. Skin around the anus is ulcerated. Next one is calcarea floor. Internal piles with constipation and backache. Much flutters in the colon. Means gas formation in the intestine. Bleeding piles with itching of anus. You should know there are bleeding piles and non-bleeding piles also. This is given for bleeding piles with itching of anus worst during pregnancy. Apis mellifica. Hemorrhoids with stinging pain as if from the bite of the honeybees and after the confinement. Colocynoia can. I am hearing this for first time. Sensation of sharp stitches in the rectum. Sense of constriction. Painful bleeding piles or blind piles. Hemorrhoids with most obstinate constipation and piles during pregnancy alternate with diarrhea. You can give this remedy. Ficus indicus, mother tincture. Neither this remedy is being tried. If any other remedy is being failed, this will stop bleeding after about 4 doses or 5 drops in each 100 ml water. Blood should be brighter, then you can take off. Apis mellifica. Hemorrhoids with stinging pain as if from an bite of an honeybees and after the confinement. And you can also go with MML. MML is my favorite remedy in the hemorrhoids or in the piles. Hemorrhoids after confinement. And also blood is dark, profuse with soreness in the rectum and great weakness after bleeding. Means of course they will be having so much of great weakness after bleeding, right? This also happens in this kind of hemorrhoids. Hypericum. Bleeding piles, it is very specific remedy. Calicar. Piles revealed by heart pressure like sitting on an horseback without any kind of seat. Okay, that kind of pain will be there. But always colica patient wants to pressure up themselves. Why they have to pressure up? Because it can come easily, but still they have to pressure up. I don't understand why these persons really like the pressure, because everywhere if you see, they always like this kind of things. They always like to put them under pressure. They always like to work under the pressure. They always like to push pressure on others in the work or in any kind of family environment and everything, because they are little bit kind of strict and just like army kind of people. So you can also give calcarea carb after the childbirth. Means the patient is suffering with piles because of the pregnancy or because of push in the normal pregnancy, the piles have been come out and they are having the external piles like that. Hemorrhoids are large and swollen. Milliphonium. Bleeding hemorrhoids. Blood is bright red. Worst better in tincture. 5 drops of a dose thrice daily. Minismo. A single dose of zigzag cures external piles. It leaves made into an poultice with oil and tied on the anus, causes immediate relief in the pain and also causes residing of the piles. Mucona. 1 drop a dose in every near specific or bleeding piles. 4 doses with the cure of the disease. It does not good if you are using in a potency form. You should be using it in a drop wise in a water. Okay, nitric acid or hemorrhoids and fissures at the same time. Then you can think of nitric acid. I already said about nitric acid. There should be burning, bleeding. Burning should be like acid burning, that kind of burning, redness, everything should be there. Okay, then only you can think of nitric acid. Podophyllum, internal and external piles. I had already said, I first forgot to say in the introduction that there are 2 types of piles. One is internal piles, one is external piles. Internal piles is, we know that the piles is present but it is not shown outside. External piles is the piles will be outside, which is shown externally. It may be 1, 2 or 3, or it is a bunch of grapes like that. Internal piles is also a piles which comes out during the passage of stool or any kind of stress or any kind of thing. After that it is gone back. And one pile is there, it comes out. If you push it back with your finger, it also goes inside like that. But if it is totally external piles, which is in the 3rd stage or 4th stage, it does not go in. That's it. Okay, and if you ask which is very painful, both are painful, but external piles is very painful because the patient cannot sit, walk, because it is very touching. Whenever it touches, it pains, and which also stings like that. Next one is podophyllum, internal and external piles. For both type of, means for any kind of piles you can give. Prolapse of rectum, because of pressure or because of piles there is a prolapse of rectum. Constipation with hard, dry, difficult and whitish stool, or constipation alternating with diarrhea. Next one is stephysagria, reappearance of the piles after some time of their operation. Then also you can think of stephysagria. Sulfur, a dose of sulfur in the morning and a dose of naxomica at bed, and a dose of Aesculus ep at noon will cure piles, any kind of piles. Why I am saying this in the last is, I give it like this because whoever comes with the piles, whether it is an internal piles, external piles, only piles, there are no other complaints, only piles which is also bleeding, non-bleeding, any kind of thing, I go with these 3 remedies. Means sulfur in the morning, night in the sulfur in the morning, Aesculus hep in the afternoon, and naxomica in the night. If you are giving sulfur in the 30 potency, naxomica and Aesculus hep should be given in the 30 potency. Okay, and everything should be same, the potency should be the same, repetition should be same, the potency change should be same, like that. If you ask why are you giving 3, because it has shown so much of good results, because the piles patient who comes, they will be so much in hurry to go and take the surgery, but we should give them an immediate relief, and we should also make them believe that they are getting cured, right? So I preferably give this one, and most rarely I skip this step when I feel like that person is not sulfur or naxomica, because naxomica and the sulfur patient are little bit similar. They are hard workers, they are knowledgeable, and because of their work or because of their bad habits, or they had gained this kind of thing and everything, so better go with this kind of treatment. Podophyllum is also best biochemic form, so don't worry about that. Go with these 3 if it is not troubling piles, but if it is, there is a bleeding and heavy bleeding, and the patient is really intolerable, like that, and or go with hemorrhoids to stop the bleeding, or go with these 3 remedies. And hemorrhoids also as a acute remedy for stopping the bleeding. After the bleeding stops by hemorrhoids, but continue this medicines. So myself Dr. Mika from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. If you have any kind of doubts, please do comment on the comment section. If you have any kind of recommendation for me about your favorite diseases or the diseases which you want to know about homeopathic treatment, please do comment on the comment section. And don't forget to like and share and subscribe my channel. And you can also press on the bell icon so that whenever I put a new video, you will be notified. Don't forget that, because if you are not notified, you are going to miss out my videos. Thank you. Have a good life and a fantastic life. Bye bye.